As you are well versed with what is visit, now we will discuss how we deal with the configuration of the visit, how we schedule the visit, how we tell the patient or the subject when he has to contact or when the clinical team is contacting him. We will give the information to the system so that the system will give the more information to us. So that is visit schedule. We are scheduling the visit for the subject, or when the subject should contact clinical team, or when the clinical team should contact the subject. So what is a scheduled visit, or what is a visit schedule? It is a planned visit of appointments between clinical team and the subject, and it should give dates. Without dates, if there is no dates, it is not visit schedule. Those are appointments, those are planned. If there is no date, it is not a scheduled visit. This date should be given by the system. Okay, if the system displays in this date the subject has to come, then that becomes a scheduled visit from the perspective of IRT system. Okay. So these are all the various parameters we configure for the visit schedule. First one is visit. So actually visit means what is a visit name, what is a visit type, we will check deeply into it. What is a visit order, what is anchor visit, what is a visit window, what is min day, max day. One more is missing here. There should be target day. Yeah, target day is missing from this presentation. Dispensing visit description. So these are all the parameters we need to consider while we are scheduling the visit, or while we are generating the visit schedule. Next one is parameters, and that is visit type. First one is in the parameters, first one is visit. So what exactly meant by visit here is, see, there are different visit, right? Screening, first visit, screening, or pre-screening. They can be different names. So that is a system. What investigator wants or the end person wants, we can give them their name, what from their perspective. This is known as configurable system. Whatever the end user or the sponsor wants to name this screening, we can name it. How do we name it? From here. For example, I have seen some trials where they call screening as enrollment, or they call it as a baseline visit, or they call it as visit 1. Okay, this screening can be given any name. This name has to be displayed to the end user, not the internal screening. That's how the system becomes the most flexible system or configurable system. When you give the name, visit name, that will be displayed to the front user, not this screening. For example, if you name this as screening, it will be displayed as screening to the end user. But if you give any name, for example, if you give Pushpa 1, okay, then the screening can be seen as Pushpa 1 or Pushpa 2 to the end user. So the name you have to remember here is, this is the name which will be seen by the end user. Yeah. Next one is visit type. See, in visit type you can see we are given the name. For example, for screening I have given visit 1, or I have given in the previous first section I have given the visit 1, or I have given baseline visit, or I have given enrollment. Any name I have given, but what is that actually in our system? In the background, what is it? That is known as visit type. What are all the visit types we have? Pre-screening, screening, run-in. We have seen all the visit types, right? Any visit type that is coming in the drop down can be mapped to this visit name. Second one is visit type. So mapping the client name to our system actual functionality, that is visit type. So for example, client wants to call pre-screening as some other name. That name has to be linked with the system functionality, any desired system functionality. That system functionality we will decide in visit type. So what is a visit type? The same functionality is going to be applicable for that visit. Next one is visit order. So we have to tell the system, clinical interactive system, what is the first visit, what is the second visit. For example, a clinical trial can have pre-screening, screening existing, and run-in or randomization, scheduled visit, completion, follow-up. So how will the system know that which is the first visit, which is the first transaction for the patient? We will give the sorry, next one, right? So next parameter is sequence. So next parameter is the sequence or the visit order. Visit order is a sequence of visit. Which visit has to come first? For example, we have different visit: pre-screening, screening, run-in, randomization, scheduled visit. Okay, discontinuation will not come here. Completion, follow-up. So how will the system know that first it has to do pre-screening, after pre-screening it has to do screening, after screening it has to go for a run-in? So how will the system know? So when you give the order, first transaction that will be done for that particular subject is in this order. So if you select the order, the system will know that first transaction will be this, and the second transaction will be this, third transaction, and the final transaction. This is the sequence of the transactions that has to be occurred for the subject. Next one is anchor visit. It is very important to understand anchor visit. For that we will take a scenario. Okay, let's have I am reducing the size of the pen. Is this small line visible to you?
Yes.
Yeah. So on coming to anchor visit, we will take an example. If we know it by an example, it will be very easy. After that we will come to the definition. Think there is a patient. This is the first visit. First visit is screening. Okay. Second visit is run in. Third visit is randomization. Fourth visit is scheduled visit 1. Fifth visit is scheduled visit 2. Next visit is scheduled visit 3. Okay. After that, scheduled visit 4. After that we have completion. After that we have follow-up. Okay, these suppose in a protocol we have this transaction, you assume it. Normally the first visit of the patient is called day 1. Day 1. Any transaction, if the screening is the first visit, it is called day 1. Okay, if pre-screening is the first visit, then that day on which the pre-screening has occurred is known as day 1. Okay, after first visit is by default anchor visit. You will understand why the first visit anchor visit. Just bear with me for 5 to 10 minutes, then you will understand why it is an anchor visit. Next visit, run in. This can be anchor visit no or yes. All the subsequent visits can be no or yes. No or yes. This can be no or yes. No yes. No yes. No yes. This is not applicable. We will check why the first visit is anchor visit and last visit it is not applicable. We will check now. Okay, you have to remember this. For last visit, Anchor visit, yes or no, you can keep anything, it is not applicable. Even if you give, it does not have any impact on the system. Why first visit, whether it can be screening or pre-screening, is anchor visit. What you mean by anchor visit is from which visit the new visit is calculated. For example, the patient has come for screening, example 1st Jan 2025. Okay, think that for a subject, first visit or screening visit is on 1st Jan 2025. We'll have soft window and hard window. I'm not discussing this slide because after discussing min day, max day and target day, we will again come to soft window and hard window. Unless you understand min day, max day and target day, so you will not understand soft window and hard window. I will come to this again. Okay, now I am skipping this slide and I am moving to min day, target day and max day. Okay, this are to be on the same slide. I will explain you what is this. For example, we will take one more scenario where in a clinical trial we will have screening visit, run-in visit, randomization visit, scheduled visit 1, scheduled visit 2, scheduled visit 3, scheduled visit 4, completion and follow-up. Take this as an example, and you will also have min, target, max. Okay, so for example, if I give the target day as 7, what I mean by is the anchor day is 7. 1st Jan 2025 screening has occurred. Then if it is if I say target day 7, okay, this run-in visit should happen on 7 Jan 2025. Okay, so now Jan 7th is the target day. Actually the patient has to come on 7 Jan, but practically it is not possible, right? If I say the patient will be somewhere else, he is a old patient, he will be 90 years or 80 years, when I say you have to come on the same day, 7th day, it will not be possible. That's the reason we will give some range. So how many days before this target visit he can come is known as min day. For example, if I given min day as 3 days. After this target day, how many days it is allowed in the system or allowed by the protocol for the patient to come? If I give 3 days, so what is the 3 days before this? On 4th, on 10th Jan. So basically what system says is he can come for that visit from 4th Jan to 10th Jan. Okay, target day, if I am giving min day as 13, it is on 4th Jan. If I am giving max day as 3, it is 4th Jan. If I giving max day as 3, it is on 10th Jan. We go to the definition, number of days before the target day. This is a target day. Min day is the number of days before the target day. The subject is allowed to be considered as within the window. So we will go to that. What is window? What is hard window, soft window? As of now, you have to understand target day is the actual day, but practically it is not possible. That's the reason every clinical trial will allow a certain window that we call as visit window. We look into that later. So this 4th Jan to 10th Jan it is allowed. 4th Jan is known as min day and 10th Jan is known as max day. So target day, the ideal day, this is the ideal day the patient has to come. From where? Previous anchor visit. This you have to remember. From which day? Previous anchor visit. Okay. Next, max day. Number of days after target day. number of days after target day. Okay, yeah. Now we will go back. Now we will look into visit window. For visit window, take this example. Min day, sorry, min day, target day and max day. Target day is 7th Jan, min day is 4th Jan and max day is 10th Jan. What happens if you if you check a particular visit as soft window, right? Someone is asking what will happen if the patient comes before 4th Jan, after 4th Jan. If the system, if for this particular visit you have configured soft window as S, then the patient is allowed before 4th Jan and he is also allowed after 4th Jan. But there is a catch. It has to be recorded in the system. System will ask you. You can see in the configuration, the system will give you a what we call notification that this patient is out of visit window. Do you still want to continue the patient? If you check yes, the system will continue. If you check no, the system will discontinue the patient. For soft window, you can record the patient and continue the patient in the treatment or continue the patient in the clinical trial, but you will be the investigator will be asked a question: do you want to register out of window? It is both possible before the min day and after the min day. When the patient comes for the visit out of window, if it asks the question and it allows the patient to be continued into the study, then it is called soft window. And I think you might have guessed soft hard window. Hard window, if the patient is out of window for min day or after max day, the system will not allow to register that particular visit. There is one more thing I want to tell here. Take a scenario where scheduled visit 1 and scheduled visit 2. Scheduled visit 1, min day, target day, max day. Okay, 4th Jan, 7th Jan and 10th Jan. And scheduled visit 2 is 15th Jan, target day is 15th Jan and 3 days before 12 Jan, 3 days after 18 Jan. Think for a particular patient, for scheduled visit 1, these are the dates, and scheduled visit for these are the dates. So there are the patient has come out of window for this. Okay, the patient has come on 11th or the patient can come on 3rd. System will not allow him to register this transaction, so the system will skip it. And also here you can see, if the patient again comes on 12th, okay, the system will register him for scheduled visit 2. This is one possible scenario. There are different ways to handle this. Different sponsor wants to have different ways. For example, I have seen a protocol where if the patient misses one one visit schedule, the patient is discontinued from the treatment. He will not be going to schedule visit 2. Some protocols will allow, if he is not within the window for schedule visit 1, he can be again registered for schedule visit 2. This is also a possible scenario. In one more scenario, One more scenario is we can register unscheduled visit. So this is all configurable. What you have to do is dependent on individual protocol. So some sponsor wants to continue completely discontinue, some sponsor wants to register them to schedule visit to, and some sponsor wants to have a unscheduled visit. So there are lot of scenarios that can happen when the patient is out of window, and our system is flexible to handle all these scenarios.
ClinGenius Research.